I'm Dr. Stephen Avery. I'm an assistant professor of radiation oncology at the University of Pennsylvania in the School of Medicine. Dealing with cancer, it's tough, it's difficult. My own mother, she passed away from cancer. As you go through the process, you get to a point where, the doctors have different options and, you never want to hear, we've tried all we can. So I guess the best part of my job is to be able to give someone another option. If the tumor is 2 centimeters, you need to spread it out. So what you would do is you would send protons with multiple energies. So you would have multiple Bragg peaks that you add up, and the result is called a spread out Bragg peak. I'm mainly involved with the Proton Project here at the University of Pennsylvania. And we have several projects, research development projects ongoing. We're developing a multi-leaf collimator to be used for proton therapy. We're working on how to implement scan beam for treatment of shallow tumors. We're looking at microdosimetry projects and also creating a dedicated PET device. Now the dedicated PET device is the project that I'm primarily working on. And the reason why we want to create a PET device is in proton therapy, the main reason why we want to use protons is because it's a stopping beam. If you compare it to photons, photons continue throughout the body, but the protons actually have a finite range. But the point is that range can vary, and you want to know where that proton stops because you want to make sure that you're not treating normal tissue. So with a dedicated PET device, what you can do is that you can image the proton, and right after the treatment, you can look at if you treated the right location. You can see if there have been anatomical changes in the patient, because if there are anatomical changes, that means that it can change the range, and then you should replan the patient. And inside our treatment nozzle is where we can either treat in double scattering, where we have a scatterer which spreads the beam and shapes the beam, or we can use what's called spot scanning, which we can take away all the apertures and the scatterers, and it just uses a magnet just to stare a spot around the patient. The source starts at the cyclotron. The cyclotron emits 230 MeV proton. That's the highest energy proton that we're able to create at our center. So once that proton comes out the cyclotron, we have an energy selection system where we can degrade that energy based on the depth of tumor which you want to treat. After that, it will go through a series of magnets which will focus the beam and also can turn the beam. So we have 5 rooms, we have 4 gantries, and we have 1 fixed beam room. And we can send the beam into any room. We can't do more than 1 room at a time. When the patient first comes in, they get a CT of the area which needs to be treated. And the doctor draws, he draws the volume of the tumor which needs to be treated, and he also draws the volume of the normal tissues which he wants to spare or limit the amount of radiation they receive. He writes a prescription to say that I want to deliver this much dose to the tumor, and I want to limit this much dose to the normal tissue. This information goes to our dosimeter. Our dosimeter comes up with a plan to calculate this is the beam that you need, or the number of beams at this angle in order to achieve your objectives. You have a source, which is protons. You have a target, which is a tumor, and you want to see what happened. In this case, did I kill the tumor? But I want to make sure that I'm not hurting any other normal tissue. Once we have a final plan, then we can put that into our record and verify system. So when we treat, we know what beam to deliver to the room based on the plan that was calculated. My background is in high energy nuclear physics. And I think when I came here, I wanted to do something more applied. But I think that the most fulfilling part of the job is that I get to work with people from different disciplines that we all want to achieve the same goal, but have different backgrounds, we have different approaches. So I may work with a biologist and a chemist, someone who is an engineer, So we have all these different people from all these different backgrounds sitting at the table trying to solve a common problem. And what's interesting is that I'm learning from everyone at the table. I'm learning some biology, I'm learning some molecular imaging, I'm learning about some radiology, and so it just makes me a fuller person because I am taken from all these different disciplines. And I'm also sharing my physics background